So when it comes to our bodies, we all at one time or another have questions we find embarrassing to sometimes downright disgusting. Well, there is no reason to suffer in silence any longer, as Dr. Roshini Raj, a gastroenterologist at NYU Medical Center, has teamed up with the editors of Health magazine on a new book that's titled What the Yuck? The Freaky and Fabulous Truth About Your Body. Dr. Raj, thanks so much for being here.
Oh, my pleasure.
So as a doctor, how often do you get faced with sort of embarrassing questions, and how do you tackle them?
Well, you know, I'm a gastroenterologist, as you said, so almost every question I get is somewhat embarrassing for the asker. But it's amazing because, you know, women will come into my office and they're kind of hemming and hawing and they don't want to look me in the eye, and they'll finally blurt out their question. And I tell them, you know, this is what I do every day. I hear this all the time. There's no reason to embarrass. And in fact, you know, we did a study in the magazine, 67% of women have had a medical issue they've been too embarrassed about to discuss with their doctor. You could be ignoring something serious or just something that really affects your life.
Yeah.
So we wanted to put it in a book in the privacy of your own home. You can read all about these topics and then realize that other women have these questions and you should go talk to your doctor about them.
Okay, so let's jump into a couple of the questions that you get frequently. First of all, a breakfast bombshell. The question is, why do my bowels go crazy after I down a big latte?
Yeah, so this is very common. In fact, some people actually drink coffee in the morning because they do want to go and it keeps them regular. The thing here is caffeine, which is in coffee, basically causes your colon to contract, and it can contract a lot, and whenever your colon contracts, it's pushing everything out, and sometimes it could even cause diarrhea. Now, if you add milk to that mix and you happen to be lactose intolerant, which many people are, you're going to get the sort of double whammy of the runs. So if you're having this problem, try switching to decaf, cut out the milk, and it probably will help.
The next question is interesting. It's about sex, an unexpected side effect that some people have after sex. The question is, why do I get headaches after sex? Am I allergic to my orgasm?
Some people actually get headaches after sex, and there's something called an exercise-induced headache that you can get after any kind of strenuous activity. And for people who get those, sex could be just one more exercise that causes headaches. But for other people, what can happen is you have a contraction of the muscles in your neck, in your scalp. While you're having sex, people do tend to tense up those muscles, and that can bring on a headache. So if you're someone who gets headaches like this, one tip is to take something like an ibuprofen about half an hour before you have sex, and that might prevent the headache.
This next one is kind of embarrassing because it deals with body odor, and anytime you deal with body odor, it's embarrassing.
Yes.
The question is, I use my deodorant every day, but my pits still reek. What should I do?
Sure. So, you know, body odor, like you said, is something people don't like to talk about, but many of us experience it at different times in our life or different times of the day. So one thing you might want to look at is your diet. There are certain things you may be eating that actually will come out in your pores and cause you to smell more. So alcohol is one, spicy food, garlic, onions. If you're having a lot of body odor problems, you might want to try cutting these out of your diet and see what happens. Another thing is to look at your deodorant. Now you have to make sure it's an antiperspirant and deodorant. They don't all have both components, so you need both of those. And check the aluminum chloride percentage. You want it to be at least 12%. If you're still having issues, talk to your doctor because there are actually prescription strength deodorants out there.
Now, speaking of diet,
Yeah.
Another question that women often have is, whenever I diet, I get horrible bad breath.
Yeah,
What is causing that?
This is a very common complaint, especially with the low carb or no carb diets. You know, when you're on a type of diet like that, you end up breaking down fat, which releases something called ketones, which can affect the odor of your breath. But even regular diets can cause this because when we're dieting, we're restricting what we take in, and sometimes that can lead to dehydration. When you're dehydrated, your body does not produce enough saliva, and saliva actually helps keep our mouth fresh. It clears away bacteria, keeps everything moist. So drinking more water, even if you're dieting, can really help with this issue.
Okay, now the next question relates directly to me. How bad is it to drink a glass of wine now and then when one is pregnant?
So this is something that comes up so often because, you know, we see women in Europe drinking the wine as they're 8 months, 9 months pregnant, and we as American women wonder, is this safe? You know, the answer is we don't know how much alcohol is safe, but what we do know is fetal alcohol syndrome is a very real issue, and it can cause devastating effects to your baby. And since every individual can process alcohol a little bit differently, we really don't know what a safe level is for you as opposed to someone else. So what I recommend is totally stay away, since you don't know what's safe. And the way I look at it is, being a parent involves so much sacrifice. This is a small sacrifice to make, and it's sort of like you should be willing to do this if you're willing to have a child.
Now we have time for one more embarrassing question. I have to travel a lot for my new job. Will I get sick more often if I'm a frequent flyer?
Yeah, and you're right. It's not too embarrassing. And what this book also has is questions you just might not bring up with your doctor because you think they don't think they're important enough. But these are things we wonder about. So people worry about recycled air in airplanes and thinking that they're going to get a lot more germs that way. The truth is, the way they filter the air in airplanes, it's probably cleaner than the air in most office buildings. So you don't have to worry too much about that side of it. However, you are in a closed space with many other people. So if they have colds or coughs, they're spewing their germs. Even touching the different surfaces in the plane can contain viruses. So you do have to be a little careful. Bring your antibacterial wipes with you.
Gotcha. All right. Some great advice. Thanks for joining us, Dr. Ross,
Thank
with
you.
answers to those embarrassing but important questions. And for more, of course, check out the new book, What the Yuck? And for all answers to your health and wellness news, head to the health page at abcnews.com.